Hello, my name is Jim Allwine. I'm speaking today on behalf of the Grandparents for Vaccines organization, and I'm a retired professor from the University of Pennsylvania, and I'm a virologist. I've studied virology for over 50 years, uh, and some people ask me how I chose virology as a profession. And while I might answer, quoting the Grateful Dead, what a long, strange road it's been, really, there was a pivotal point in the summer of 1954. I was 7 years old. I was at home, not allowed to see my friends, not allowed to swim in the lake. It was the polio epidemic. On that day, my mother excitedly ran into the living room, showing me a newspaper with a picture of Jonas Salk, and said, "A vaccine against the polio virus has been invented." And I distinctly remember asking her, "What's a virus?" And she said, "It's something that makes you sick." I was intrigued. And this was bolstered on a day in April 1955 when my second grade class was led down the long hallway of the school to the school nurse's office, where a local doctor gave us our first polio vaccinations. I have a picture of that. So this is a clipping from the Gazette and Daily. It's a newspaper from York, Pennsylvania, and it's April 28th, 1955. And you see Dr. Charles Hawkins here, a country doctor in our rural community of Spring Grove, Pennsylvania. He's giving vaccination to my friend Brad. In the background here are Kathy, Libby, and all the way in the back is Cheryl. Cheryl became a nurse. I don't know if this day inspired her, but the boy standing in front of her in the hand-me-down shirt would become a virologist. So I was inspired by the polio vaccine. Now, I had had vaccinations before. I particularly remember smallpox. But this vaccination, the polio vaccination, seemed so very important, so urgent. The polio epidemic was causing so much fear, and this fear was made so personal by the increasing cases in our community. Children and adults were becoming paralyzed, were being permanently damaged. There were people in iron lungs, and one child died. To parents, this day in April 1955 could be a liberation day, when worrying about polio might become a thing of the past. And that happened. The vaccine worked, and all subsequent vaccines worked. People rejoiced. But as the years have gone by and more diseases have been conquered by vaccines, the rejoicing has stopped. Complacency has set in. Younger people never experienced the ravages that these diseases had before vaccines were available. And now the anti-vaccine movement and RFK Jr. have come into prominence, spreading misinformation, confusing parents about vaccinations, and doing a great disservice, a great harm to the children of America. Now, I'm a grandfather. My identical twin granddaughters, Poppy and Olivia, are nearly 6 years old, and they're fully vaccinated. And they, in fact, participated in the clinical trial for the Pfizer COVID vaccine for children. They're vaccinated because their parents believe and know that vaccines are safe and effective. But I worry about the many children whose parents will succumb to Kennedy's lies. I worry that under Trump and Kennedy's rule, vaccines may become unavailable in the future. And it's really up to us, the grandparents and parents, to protest the loss of vaccines, to protest Kennedy's anti vaccine and anti science lies. It's up to us to write letters and op eds to our local newspapers. It's up to us to protest to our representatives and senators. It's up to us to write our state representatives and our governors to ask for states to adhere to science based public health policies and to follow vaccine schedules recommended by professional medical organizations like the American Academy for Pediatrics. It's us to us. It's up to us to save our children. Be kind.